And so, of course, the third prong is the supplementation. Perhaps if we lived in a non-toxic world and our teeth never deteriorated and there wasn't need for modern dentistry with all its toxins, and we weren't pumping pollution and there was 40% oxygen in the air rather than 20%, blah, blah, blah. There wasn't DDT and other pesticides that are staying in our biosphere for centuries. Perhaps a good, healthy, balanced diet might give you close to what you need in antioxidants in your body. But that day has passed a long time ago. And there's a small, well, not that small, a large number of doctors who still want to beat this bandwagon, eat a good, healthy diet, and you don't need to supplement. That's just not true. And there's no scientific evidence to support a stance like that. On the other hand, as is cited in all the books, there's a large amount of scientific evidence to show that getting your levels of antioxidants up not only decrease symptomatology for most all chronic degenerative diseases, slow down the progression or even reverse the progression of different chronic degenerative diseases, and in recent elegant studies clearly show they increase longevity. The higher the vitamin C levels in your blood, the longer you live, period. So how do you do it? They got lots of different vitamin C supplements out there. They're all good and of benefit, but there are some that are much better than others. When you take regular vitamin C, just sodium ascorbate, ascorbic acid, some of the calcium ascorbate, which are the buffered vitamin Cs, they're really very poorly absorbed. You might take 7, 8, 9 grams and only 1 gram will get absorbed into your blood. Not a very efficient way to deal with things. Also, when you take it IV, that's great. You get a lot of good things that happen to you, but it's not a very practical thing to do. It's a very costly and time-consuming thing, but it's a good modality to remember when you're critically ill with something and you want to jump on top of it quick and effectively. They now have preparations of not only vitamin C, but just about all the different nutrients you can think of, the different vitamins, resveratrol, the B vitamins, just about everything in what's called liposomes. Now, if liposome is a brand new word to you, a liposome is actually a type of fat called phosphatidylcholine that is laboratory-wise virtually identical to many of the cell walls around your cells. So when you use the technology to form these liposomes, you're actually forming, if you will, like little artificial cells of your body, but holding the payload that you want to deliver. The vitamin C, the glutathione, the other nutrients that you want to get inside cells. And what's amazing about this science, and it's been evolving over about the past 45 years, is that you get virtually a complete absorption in the high 90s into the bloodstream. You protect the payload until it's absorbed into the bloodstream from any breakdown or neutralization by the gastric or stomach environment. In the case of vitamin C, you don't get the effect of having too much unabsorbed vitamin C cause a loose diarrhea, called a C flush. But even more importantly, the evidence is now showing that you just don't get absorbed into the blood and release it into the blood. It gets absorbed into the blood, and then in the same mechanism it gets absorbed into the blood, it will pass directly into the cell. So that you get it from taking something orally, you get an intracellular delivery.
Okay.
And this has been phenomenal for me because for the time that I was into IV vitamin C, there's probably, I don't think, a physician in the world that prescribed, took, administered, or supervised as many IV vitamin C administrations as I did. And for the diseases that I was able to see, which was not a large amount compared to Dr. Klenner, I was able to reconfirm to my satisfaction that IV vitamin C could do everything that Dr. Klenner said it could. The only thing I noticed was I needed about a 50% more dose than he used. And I think that's probably because over the past 50 or 60 years, there's that many more toxins we encounter that we need to neutralize first before we start repairing the body. So that was it. That was the ultimate. That was the gold standard. And then, to make a long story short, when I first ran across these liposomal products, I had already closed my clinic for other reasons, and I started getting sick. I didn't have access to the IV vitamin C, and I found that taking roughly 1/10 the dose of vitamin C orally encapsulated in liposomes had a substantially more profound effect clinically on infections than an IV. And it was such a profound clinical observation that I refused to believe it for at least the better part of a year, year and a half, because I just said that makes no sense. How can 5 grams of this be more impactful than 50 grams of vitamin C intravenously? You're putting it directly into the vein, for goodness sakes. And it's the ability to get it inside the cell. And it's the ability to get it inside the cell without consuming more energy in the process.